Hello everyone. So welcome to my channel. This is Shruti Ahuja, MBBS student at GMC at Chandigarh. So in this video we are going to talk about the lower limb. I and you are going to revise lower limb today. So first of all, I am having the deep fascia of thigh. I know what is superficial fascia, deep fascia, everything from general anatomy. So deep fascia of the thigh is called fascia lata. If you know Hindi, then you would be knowing that what is this and what is leg called in Hindi. So I hope you can understand and remember by this term fascia lata. Okay. So the modifications of fascia lata from again general anatomy. I know what is the intermuscular septum. So here fascia lata modifications is the intermuscular septum, saphenous opening, cribriform fascia, and the iliotibial band. Right. So and this can be learned very easily if you tend to forget such enumerations. ISI. Okay, that ISI agency. So here I am having a diagram. This is a very helpful diagram to remember a lot of things. So first of all, this is femur. I hope you know, right? This is femur. And what is this called? This, I want to tell you, this is a section like this. Okay, like a kind of coronal. So this is the linea aspera. And here there is a very small mnemonic. If you again tend to forget that the map so foolish. The map so foolish. You can make a better one as well. So here is the, or I can say thigh. Thigh is having three compartments. Leg is also having three. But here thigh is having three compartments. And what are those three? The medial, anterior and posterior. And so the posterior compartment nerve is the sciatic nerve, and the anterior compartment nerve is the femoral nerve, and the medial compartment nerve is the obturator nerve. I would again want to tell you, you can learn by some better one, but just to know, it is the SOF. Okay, so O is the medial compartment nerve. Om. Om is famous, we can say, thing everyone knows, right? Om. So, and S is relating to P, and F is relating to the A. Okay, FA, the formative assessment. Okay, so this is kind of thing you can understand and learn. So, here is one more thing, very interesting thing, that this is the posterior compartment, and pectineus is the common muscle, right? Like we can say a hybrid, or which is being supplied by the two nerves, anterior and medial compartment. It is between these two. It is not touching the posterior compartment, so it will be here pectineus. And you can guess the other thing, adductor magnus would be here because it is not touching the anterior compartment. So, and it will be supplied by both the nerves of these two compartments. Everything is a concept if you want to apply, if you want to make, right? Next is, this was the intermuscular septum. By knowing these things, just knowing this diagram, you can write around 10 points on intermuscular septum, right? And you can make a very long answer by yourself. So, saphenous opening. So this is the anterior superior iliac spine. If you don't know these terms, what is the ASIS, PSIS, these pubic tubercle, everything, you can watch any video of that pelvis, of the hip bone, the or all the bones, osteology first, from the like any YouTube video, because I'm not having access to those bones right now. So that will be very helpful for you, right? So this is the ASIS and this is the pubic tubercle. If I join these two and just joining, this is the inguinal ligament. Okay, it is extending between these two points. And if I draw a like rough triangle right here, you can see like a image of a triangle, right? So, and here I can say it is a saphenous opening. I'm not telling you what is the exact location, what is the centimeters and all. This is all part of surface, like marking surface anatomy. So here is the saphenous opening, and the great saphenous vein is going right here. Okay, and if I'm having an opening, if I'm like, you can just relate a chunni or a sieve like that. Okay, every sieve has some like a net on it. That is the cribriform fascia. That net is a cribriform fascia with holes in it, like pierced. Okay, so this is the great saphenous vein, cribriform fascia, saphenous opening, inguinal ligament. Next is the iliotibial band. Now the iliotibial band, this is the ilius, okay, the bone. This is the iliac crest, and here we are having the iliotibial band. This is if I want to know the 2 points from where to where it is extending, so it is the tubercle of iliac crest to the Gerdy's tubercle. Now Gerdy's tubercle is on the lateral tibial condyle. So tibia also has two condyles, the lateral medial condyle. This also you can learn very well in osteology, because if you don't know the like the names, the points, you will be having some difficulty in it. Okay, Gerdy's tubercle, and this is the iliotibial band. And if you want to guess by any chance that which muscle is attaching to it, I have written here gluteus maximus muscle is like having some attachments to this iliotibial band, and this is the capsule of hip joint also has some attachment, and the tensor fascial lata muscle is also having attachment here. So how will you learn the tensor TFL and the gluteus maximus is having attachment? You can learn very well with the help of a tibia. Tibia, how is that possible? So gluteus maximus G and Gerdy's tubercle, and the tensor fascial lata, the tibia. So tibia, okay. I hope it is clear. Next is clinical. If you add some clinical points to every point in your answer sheet, then you will get like more and more and more marks. Okay, so clinical IT band contracture, that is iliotibial band contracture. Never write these short forms in your answer sheets. So if the iliotibial band contracture is there, then what will happen at the hip joint and what will happen at the knee joint? So this is a famous mnemonic. You can also learn very well with it. Hip joint, it will occur like Faber, that is flexion, abduction, and external rotation. And in knee joint, you will be having the fair. Like okay, it is very weird but fair. Okay, flexion and external rotation of the tibia and the post subluxation of the tibia. Okay, so this was about our first point, that was introduction to lower limb and the modifications of the deep fascia. And next video we are going to talk about the anterior compartment of the thigh. I hope you will stay connected, and if you like this video then do save it in your library.